Hello, I'm Dr. Chris Storti, and welcome to Quality of Life Chiropractic Center. And welcome to the Trigger Point Reduction Workshop. The purpose of this workshop is to help you and your partner, and I will be teaching you a gentle muscle therapy that you can do anytime at home by yourselves. As a patient, the purpose of this is to speed up your results and, of course, save you some money. As a guest, it will help you reduce tension that could contribute to your own health problems. Now, the first part of this program, I'll show you how to treat what are known as trigger points. And the trigger points are areas of muscle spasm or tightness. Now, here's how a trigger point develops. When a person is younger, the average person has over 1,000 traumas to the spine from falls, wrestling, pillow fights, contact sports, you name it. And these traumas can leave a person with a misaligned spine and undetected nerve damage. And nerves, when damaged, can send out signals that make muscles contract. And over time, spasms and trigger points develop. And a vicious cycle occurs when the nerves become irritated and the muscles tighten up. Those tightened muscles can pull on the spine, causing the nerves that come out from the spine to become further irritated, which then makes the muscles tighten up even more. And if you only treat the muscles and not the nerves involved, you only get a temporary result. And now we correct the misalignments of the spine through a procedure called an adjustment. And a combined approach is faster and is more effective, which is why we teach it. So working on the muscles, which you'll be doing today, I work on the muscles as part of the adjustment, and we work on the structure and the nerves. So it's a very comprehensive process. Now, this program will be therapeutic, meaning it will help you feel better as the client, but for your partner, it'll also be diagnostic. And by this, I mean if you have trigger points, it's an indicator that a nerve is being irritated, and you should get checked to see why these points are there. For those of you who are guests who are helping the client, if you have more than 4 trigger points, it would suggest that there's a problem that should be checked. So now let's look at some most common trigger points. Some of these are very self-explanatory. So for example, these are the trigger points for the neck and shoulder that are the most common. Here at the base of the skull, down the shoulders, and down, of course, in between the shoulder blades. Everyone knows about these trigger points. They're very common. The lower back trigger points, you'll see going across the lower spine, down into right on the dimples, right where the pelvic meets the spine, and then down into the glute process too. So here's a couple of rules. When you're working on each other, make sure that you tell your partner to stop if they're pressing too hard or somehow the treatment is causing pain. Number two, you want to hold the trigger point only as long as it takes for your partner to feel the pain lessen. And actually ask them, is it less? And you'll see what this means in a few minutes. It takes just a few seconds for the pressures to release. And of course, the pressure is very, very light. It just matches the resistance of the person's muscles. These are not deep muscle trigger points. These are neurological trigger points. Neurological trigger points are to stimulate the nerve and allow it to release. So we can use a very light pressure and get the same result as someone using almost a massage technique where they're digging with their elbows in their hand. So this is a very unique process that you're going to learn today. Now, before you begin treating each other, watch me demonstrate where these points are and how you'll treat them. Uh, there will be some pain if you hit a trigger point, and you need to apply just enough pressure to allow the trigger point to relax, which it will do rapidly if you do it just right. Now, it normally takes less than 10 seconds for a trigger point to relax, and what you'll do is you'll ask your partner to tell you when the pain feels less but not totally gone. And when the pain becomes less, you are done treating that point and you move on to the next spot. All right, so let's get started. And then we're going to teach you a home program to help you reduce muscle tension and speed up your healing process. One of the big concerns that people have when they're doing muscle work at home is they get concerned that they don't know what they're doing. Number two, they feel like they don't have the strength to do it. And number three, they get tired very quickly. And we're going to handle all of those issues today so that you can do this at home and solve all of those issues. And one of the reasons, the biggest misunderstanding we have is people try to go too deep. They think they have to press in very, very hard, and that's the only way to make a muscle relax.
Now, there are times and places for deep tissue pressure points, but this is not that. What we're trying to do is bring the body into a more relaxed position and calm down the muscles so the body can heal from the inside. The best analogy I can give you is a handshake. Imagine someone who's very strong, very big, giving someone smaller, a very strong, very forceful handshake. The smaller person has to resist with all of their energy. And if they continue that for a few seconds, the smaller person's going to become fatigued. And that's exactly what happens to the person's muscle. My large pressure against the small muscle, the muscle is going to get weak, it's going to fatigue itself, and as a result, it produces lactic acid and becomes sore. Almost everyone's had a massage or known someone who's had a massage who is more sore afterwards, and that's the reason. So what we're going to do today is something very gentle, very honoring to the muscle and to the body, so that the person that you're working on can actually heal and feel better when you're finished. The first thing you want to do is put them in a comfortable position. Alicia's in a sitting position. You could be lying face down. You could even be on a high counter leaning forward, almost like a massage chair. And, you know, we're going to work on her today sitting because that's the most comfortable position for us. But don't worry about finding the right specific positions where you press on the muscles. You don't have to exactly know the muscles. You're going to actually work on the entire area, and that's going to get all of the issue that needs to be handled. So one of the first things you want to do is get a sense of the tension inside of her shoulders and muscles. So you want to feel the muscles on a person. Now, some people have very, very tight, very stringy muscles. Some people have very dense muscles. And so you'll need to use different pressures. The best way to practice is to actually put your thumb and your finger together and feel the muscle right here at your thumb. When your four fingers together, it's a very light pressure. As you move to different fingers, the muscle gets tighter and tighter. And as a result, you have to put a little bit more pressure. But it's not tremendous. It's not deep, deep pressure. The amount of pressure you need to use is just to engage the muscle. We call this rapport, or matching of the tone. If you match the tone and match the pressure in the person's muscle, their body can actually relax. So let me actually demonstrate how this works, and then you can see for yourself. So if I was to press on her very deeply, and I was to find the muscle, here's a muscle that has a little bit of tension. If I'm to press in very deep, you see how her body starts to react. She has to resist me. My arm is contracted. My muscles are contracted. I'm going to get very tired quickly, and her muscles are going to become irritated very quickly. It's not pleasant for either one of us. Now, if we do it differently, we're going to do just a soft, gentle pressure. We're going to just meet the muscle, and we're just going to hold it. And what you'll see is all I have to do is just apply a little downward pressure, and she feels that. Can you feel that pressure there? Yep. Okay. What I want you to do is, as I hold this, Alicia, just tell me when you notice it gets less. Okay? Tell me if you feel it. Okay. Good. I'm going to move to the next spot. Okay. Good. And so these pressures are going to release in a matter of a few seconds. And if you watch her, as soon as I hold it and relax, she takes a nice breath, her muscles relax, her body actually sags into the chair just a little bit more. And if you do enough of these across the entire area, her body will actually relax and she'll feel better. It's actually good not to go right into the sensitive spot, but actually to work around it. So if she had tension in the upper part of her neck, I would start here at her shoulder and I'd move up her trap muscles, maybe down between her shoulder blades, and then eventually work into the neck where she has the issue. If she had headaches, we could work off actually into the skull. These pressure points work in any part of your body. If she had sinus issues, we could press points on her face. If she had lower back issues, we could press on her back, her legs. Heck, even carpal tunnel, we could press on the forearms. So this is usable on any part of the person. So that's how to do the pressure point technique. If you have any questions or concerns, come in with your partner on the next visit, and we'll show you how to do this in person. Thank you.
I'm so glad you've taken the time to watch this workshop. In the next few minutes, I'll show you how health problems develop. But first, I'd love to get your help. I'd love to bring our workshops to the community. Now, I offer these workshops to, like today's program, free of charge for clubs and churches and groups and businesses and support groups and so on. And we have workshops on everything from weight loss to women's health problems to digestive issues to arthritis and even fibromyalgia. So a support group that's already struggling with one of these issues would be the perfect place to go. So if you know a group or a club or church or organization that might like one of our free workshops, do me a favor, give me their information and I'll take it from there. We have little cards like this in the office you can fill out, or just simply reply to the email that you got this from originally, and it'll get back to me and we'll take it from there. So I really appreciate your help. Now, I'd like to discuss with you what health is all about. Now, you may agree with this that we live in one of the most affluent countries on the planet. Yet we are not the healthiest. We are 50th in overall life expectancy. We have obesity and diabetes reaching epidemic proportions. And it tells us that we obviously need a new direction to achieve health. So let's take a look at why our country might not be as healthy. And it's because there are some very common mistaken beliefs about health that you might have. And part of it is many of these beliefs come from advertising, which is not necessarily a source of accurate information. A statistic I found was that most health information comes from young internet influencers, not experts and doctors, but from people selling products or selling likes on Facebook and social media. So this is where a lot of our information is coming from these days. And because of that, most people assume illnesses are normal at certain ages. And for example, we assume that arthritis is normal and that we're just going to get it when we get older. And that's not true. We can go into more detail, but arthritis is a reaction to a problem. And so just because illness is very common in our population does not make it normal. So what happens is we fail to recognize that an illness is a failure of the body to function properly. And all health problems are caused by the body malfunctioning. And therefore, there are no normal symptoms or illnesses. You would check your car if the engine light went on. And symptoms are just that. They are warning that something is wrong because there's no such thing as a normal symptom. There's no such thing as a normal light on the dashboard. Most would get their car checked to make sure it did not get worse. And I promise you, your body deserves even more attention. Now, for a moment, I want you to think if you have any symptoms that you like to get rid of. Think about yourself. Say, do I get headaches? You know, a headache could be a minor little headache to a migraine. And it could be something you had very minor. You know, if you have headaches once or twice a year, that's not a big deal. But if you get headaches on some sort of a regular basis, weekly, monthly, gosh, I've had people say daily, or if you get like a migraine that comes like once every 6 months, but it's so intense, right? That's not normal. If you have sinus issues, sinuses are, a postnasal drip or reactions to the pollen or something. These are not normal. If you have pain in your body, think about that. Do I have pain in my neck? Do I have pain in my shoulder? Do I have pain in my back? Right? There's an indicator that something is wrong. Even allergies. We say, oh, I have the normal allergies, which people mean like seasonal. Well, seasonal allergies means your body is not adapting to its environment, and we should be able to kind of flow with the seasons and not have an issue. There's something wrong with that person. And of course, sleep issues, digestive issues, hormonal issues, irritability, the list goes on. But think about the symptoms that you have. And once you have those in mind, ask yourself, do I have more than one? Do I have several symptoms, or is that main symptom something that has a repetitiveness to it? Does it keep coming back over and over and over again? Because if you do, if that symptom keeps coming back or you have a bunch of different symptoms, then you should be concerned because a symptom is your body's way of communicating to you to say something is not right and something needs to change. And if you want to live a long and healthy quality of life deep into your higher ages, then you need to make the changes now so that your body is in good condition as you get older and naturally things start to become more difficult. So I've discovered that if you make even small changes in three areas of health, you can have a profound and lasting impact on your health. So let's begin our discussion on the three solutions to health problems by looking at the brain and nervous system's relationship to health. The nervous system controls the function of the body by sending instructions from the brain down the spinal cord and then exits out to every organ and every tissue in the body. Did you know that every nerve in the body, except for 12, go through the spinal cord? So almost everything in the body is controlled through the spinal cord. If the nervous system cannot communicate with any part of your body, then that part will malfunction. And you can see here that there's a red part on the spine there going over right to the digestive system. That's the stomach. And so if that part isn't getting the signal, then it will malfunction and it will lead to illness and eventually symptoms. And these interferences leading to this cascade is what chiropractors and myself call a subluxation. Now, some of the symptoms that result from subluxations can be quite varied because they can affect every single nerve in the body. So, a symptom up in the neck area could cause headaches, fatigue, or neck pain, whereas a symptom in the lower part of the body could cause other aches and pains, digestive problems. But here's the big one, just because you don't have symptoms, just because there's no symptoms, does not mean you are subluxation free. It just means it hasn't progressed far enough yet. So that's why it's so important to get checked, because you can't see it or feel it. You can't look in your own mirror and say, gee, I'm subluxated. You can't touch your own spine and go, wow, that must be subluxated. Although if you had 5 or 6 or more trigger points in one area, you're starting to think like maybe I do have these subluxations. So what are some of the causes of subluxations? Well, falls. Children fall 1,000 times before their teenage years. Toddlers fall down about 200 times a week. The traumatic birth. Statistically, 80% of births are trauma to the first and second vertebra. And with most of the children that come to me, we see lots of shoulder issues as the doctors are kind of over pulling and over torquing the neck and spine. Of course, sports injuries. A football game is probably about 40 to 50 traumas right there per game, per practice. So we have lots of injuries throughout lifetime. Of course, car accidents, improper lifting and slouching, and of course, the cell phone position where we're always looking down. These are all reasons why our spines develop trigger points and subluxations. Now, if your nervous system is not functioning properly, it makes one become more susceptible to stress. So let's look at how stress affects your health. That's number two area. So stress, everyone's familiar with stress, but few understand how it actually harms our body physically and what you could do to offset the damage. Now, when a person is experiencing stress, there's a gland in the body, we call it the stress gland. Officially, it's known as the adrenal gland. It secretes hormones in abnormally high quantities or over a long period of time. And these hormones were meant to be secreted for very short periods of time. And so if they are secreted day after day after day, they begin to destroy your health. And the adrenal glands sit above the kidneys, and the hormones they secrete can weaken your ability to digest, to sleep. They decrease your immune system. Also can reduce your circulation, which could lead to heart disease. But you can see how if you change the function and hormonal function to your digestive system, that person might develop digestive issues. If you change your blood flow and communication to your immune system, that person might develop allergies or sinus issues. So these symptoms that people have are rooted in a little bit deeper and can be altered by changing, again, these key places. So if our nervous system was clear, like we said before, if our adrenal system was clear, then we'd be able to function better. For example, Dr. Sternberg, who's a researcher for the NIH or National Institute of Health, their study found that people under stress take longer to heal after injuries. They have decreased immune response to disease, and they have susceptibility to infections like the common cold and the flu. This is why two people can be standing in the same room exposed to a virus or bacteria, and one person gets sick and the other one doesn't. Their body's ability to resist is so much better, but stress destroys that ability. And the solution is to simple, to rebuild your stress glands. And the way we do it is several steps, right? We restore your proper nerve function. We also eliminate some of the triggers like sugar, caffeine, and rebuild with vitamins like B vitamins and vitamin C, as well as certain extracts. Now, you'll see this product in our office. It's called the Adrenal Support. It's a white bottle with red lettering. It is one of the most popular supplements that we have. Almost all my patients take it at some point because we all realize that we're under tremendous amount of stress. Now, number three, let's look at the number three area to look at. Now, most people know we live in a highly polluted world, and you probably know that our air, our water, and our food supply have numerous chemicals in them. In fact, there are 82,000 chemicals being used on a daily basis in North America. More than 20,000 of these chemicals are things that our bodies cannot break down. Some of those chemicals are in our foods, they're in our body products, and they have the potential to alter our metabolism, cause weight gain, cause digestive problems, create nutritional deficiencies, cause hormonal imbalances, even change brain chemistry. And they all, of course, negatively impact your immune system. The result of all these chemicals impurities in the body is that they begin to clog up the filters, and the filters can't function. And the two major filters are the liver and the kidneys. So when the liver and the kidneys can't eliminate these chemicals impurities, then the chemicals move into the bloodstream and are freely floating around the body. Once the toxins enter the general circulation, they have the potential to cause great harm to cells, tissues, and organs. And so your body's secondary defense to neutralize these is to surround the impurities with cholesterol in the bloodstream and what we call fat in the tissues of the body. This leads to weight gain. So if you were to remove the chemical impurities from your body, then the body would no longer need to hold on to the extra fat and water, and thus you would lose weight. So the solution to this we call is a nutritional cleanse. Now, cleansing not only allows your body to function better, but because it removes those impurities, but of course it reduces fat and weight as well. And so we administer these cleanses to people on a regular basis. You see them in the office on the shelving. They're the products that have the nutritional and cleansing components. So along with cleansing, you also need to identify the sources of chemicals in your environment and increase your daily exercise. Sweating does eliminate toxins and increases blood flow and oxygen to the tissues, assisting the body in detoxifying itself. So there's some steps you can take, but let me know when you see me next. We'll give you some resources on all these areas that are full of chemicals in our lives, all the products, all the areas in our household that we may not think of. So I can give you those resources. So in our office, our goal is to help you and your family achieve and maintain your health throughout your life through a natural approach to healthcare. And because my purpose is to help as many people as possible, I want to end tonight's workshop by giving you two gifts. The first is the opportunity to choose up to three people you know who are suffering with any of those health problems to receive a consultation and testing in my office. So if your mother has headaches, or your father has digestive issues, or your sister has hormonal stress, or your brother has allergies, or your husband or wife or child have health issues, then let's help them. Let's give them a gift that might be able to help them. Let's inspire them to make some better changes, perhaps simple things like changing their nervous system, changing their environment, and changing their stress levels can absolutely change their life going forward. So if there is someone you'd like to help with natural health care, just reply to the email you found in this link and we'll mail them a card and a gift certificate from you. It's perfectly okay if you can't think of anyone, but I would really love to help to do this because this could change someone's life. And the second gift is for each of you who are partners listening to this, you get a checkup for yourself at a convenient time too. It's only going to take a few minutes, but it'll allow you to know what's happening with your own body. And I'll do the visit at no charge as a gift for watching and as a courtesy to the person who you are helping right now. The health of the whole family is my goal, and I don't want any barriers to get in the way, and that's why I do this for no charge. So you as the guest can schedule the visit during your partner's appointment, or you can make your own time. And during this visit, I will check for your issues in all three areas, the nervous system, the stress, and the toxins, and we'll find out where you're at as a baseline. And this will be a very comprehensive and very informative process. Again, thank you for watching. I hope there's some people you can help me help, and I hope you as well will be getting all the benefits from this trigger point workshop. And I want to see how fast your progression goes with your care. Have an awesome day. Talk to you soon.